Bismillahirrahmanirrahim. Assalamualaikum. My name is Fatin Amanina Azis. We wrote a paper titled COVID-19 Medical Face Mask Classification using CNN to detect proper and improper wearing of face masks. The other two co-authors are Hazwani Suhaimi and Emeroylariffion Abas from Faculty of Integrated Technologies, Universiti, Brunei, Darussalam. Throughout the presentation, I will talk about the introduction, methodology, results and discussion, and the conclusion. For the introduction, I'm certain that COVID-19 virus is a really well-known disease, so I don't go deeper into the definition, but I would like to talk about the transmission. These COVID-19 virus can be transmitted from person to person by virus-carrying droplets from cough, sneezes, or from people who talks, and the droplets are inhaled by another person. So this is how people got infected. According to statistics, over 190 million cases are reported and 4 million global death tolls are being recorded, which makes COVID-19 becomes the most lethal disease throughout the century. And that's why we need some prevention measures. And one of the prevention measures is to use face masks by both infected and non-infected individuals in order to limit the COVID-19 virus transmission. And with that, we have to know how to properly wear the face mask. So it has to be fitted to the nose and cheeks, covering mouth and also the chin. And there are also some cases where people wear the face mask improperly and not even wearing it, which leads to a problem because we want to limit the transmission of the virus. So this reduces the efficacy of the mask. And with this problem, one of the solution is to do manual scanning and monitoring by some personals. So the people have to check whether those people in a crowd environment or in public places are wearing face masks according to the COVID-19 guidelines in wearing face masks or not. So this could be a hassle and also inconvenient because there are a lot of people to be insured. So this is where the need for automatic monitoring comes in. And we can use employee image recognition because this is one of the popular method for automatic monitoring. And we can use many networks, but CNN is one of the efficient neural networks that have been used to detect proper mask wearing and improper mask wearing. So with that solution, the methods in this paper are divided into two phases, the training phase and also the testing phase. For the training phase, we have the training dataset, which consists of images, and then they are pre-processed, which includes resizing, rescaling, color transformation, and those pre-processed images are split into the training data and also the validation data. And the training data is fed into the classification models that we are using. And then it will be validated using the validation data, and this will be in a loop. And the output is the trained model. And that trained model will be used in the testing phase. So in the testing phase, we have a testing dataset and then pre-processing of image. And then this is where the trained model is being used. So the pre-processed image is being fed into the trained model to predict the proper mask wearing and improper mask wearing. And next is the dataset allocation. So we took images from the mask FastNet dataset, which consists of over 133,000 images of human faces with incorrectly and correctly worn face masks. But we only take a part of it, about 29 images, and then split it into 90 to 10% for training dataset and test dataset. And the training dataset is further split to 80 to 20% for training and validation. And for training, it is divided into two classes, equally distributed for correct mask faces and incorrect mask faces. And these are the samples of the images that are being used. And the same goes to validation. And for the testing dataset, since it is used for evaluation, we use the combination of correct and incorrect mask faces and fit into the trained model for the evaluation of performance. Next is the CNN models that are being used. So we used and compared these three models, ResNet 50 version 2, DenseNet 1-to-1, and also MobileNet. And we evaluate the performance of these three models using three common metrics: precision, recall, and accuracy. So precision, recall, and accuracy are computed from confusion matrix, and then using this formula to get the values. So higher precision, so precision would mean that the model is very specific, and high precision would mean that it has few false positive. And recall means that the model is highly sensitive, and high recall value indicates less number of false negatives. And accuracy, the higher is the better. So this is the correct predictions in percentage. So for the results and discussion, as we use precision, recall, and accuracy to evaluate the performance, we need confusion matrix. So these are the confusion matrices for ResNet, DenseNet, and MobileNet. Going vertical is the actual value, and going horizontal is the predicted value. As can be seen, ResNet and DenseNet is very accurate in determining the proper mask wearing, and MobileNet is more accurate in identifying improper mask wearing, where 9 images, in which 9 images are misclassified as improper mask wearing, where the actual fact is proper mask wearing, and 34, which is the lowest among ResNet and DenseNet, is misclassified as proper mask wearing when the actual is improper mask wearing. And for ResNet and DenseNet, there is no misclassification for improper mask wearing when the actual is proper mask wearing. So from this, these are the sum of the testing results. The first row is predicted as proper mask wearing, and the second row is predicted as improper mask wearing. So from the misclassifications from the predicted results, further verification or further investigation is being made. So it is found that the misclassifications are more prone towards the faces with uncovered chins. So as can be seen here, these first two images is actually improper mask wearing, but they are predicted as proper mask wearing. So for the future, maybe images with uncovered chins can be fed more into the training dataset so that the model can identify such images more accurately. And next would be the summary of results for the precision, recall, and accuracy. As can be seen, ResNet and DenseNet has the highest precision, which makes them very precise in identifying images of improper mask wearing. And MobileNet has the highest recall value, which makes it less probable in misclassifying improper mask wearing as proper mask wearing. And the accuracy, MobileNet is found to be the highest one. So in order to evaluate on which model is suitable to be used, depends on the situation or condition of COVID-19. So during the peak time of COVID-19, people are compulsory to, it is obligatory for people to wear face masks, right? So using a model with high recall value is very important here, because low recall value, and for this case, ResNet and DenseNet has lower recall value than MobileNet. So those recall values with low recall value can give a false sense of security, in which further verification may be required. For example, when you're wearing a proper face mask, but the model detects it as improper face mask, so unnecessary further verification is applied. So here, that is one of the drawbacks of low recall value. So that's why during the peak time, MobileNet with the highest recall value is more suitable. So to conclude, ResNet and DenseNet are suitable to be implemented where further verification cost is high or the precision is high, and MobileNet is more suitable when the authority wants to ensure that people are wearing their face masks correctly to limit the spread of the virus. So for future work, this may be implemented for automatic monitoring in public places, and this is also beneficial to ensure the compliance to limit the COVID-19 virus transmission. That's all. Thank you very much for paying attention and listening. Thank you.